The boomers will begin to turn 65 less than 2 years from now, on January 1st, 2011. That date will mark the symbolic beginning of the aging of America. Of all the new challenges that aging America will bring to us, perhaps the biggest will be healthcare, as I said earlier. In fact, our ability to adapt our healthcare system to an aging nation may be the paramount issue for America in the 21st century. At AARP, we're focusing on 3 key goals for the reform of the healthcare system. Number 1, we have to ensure that people age 50 to 64 have a choice of affordable health plans. I think this is a high-risk population, especially for not only the people 50 to 64, but people in their mid-40s who start losing their positions, their jobs during an economic time like this. It is very, very difficult, very expensive to purchase health care that is affordable for this age group, because this is a group that's at risk for different health care problems that emerge. The second point that AARP advances is that we have to strengthen Medicare for current and future generations by lowering the health costs, removing the waste, and reducing medical errors and poor care. And the third and last point is that we have to help people stay well enough in their homes and out of costly institutions by promoting, on the one hand, chronic care programs that help people manage, because it's so common and so often that people who are older will have multiple conditions they're managing. There's evidence that we can manage them better. We oftentimes will end up using health care unnecessarily. That costs us personally money, and it costs your health care system money, and it costs all of us as taxpayers money. So these are some things that can be done there. The majority of types of things that affect chronic disease are things that we may have easily and certainly within our control. And we don't always need physicians in this, and we don't need even nurse practitioners doing this, but it's a matter of thinking about exercise, wellness, being part of a community. I think we have depression actually is one of the most common conditions that affect those of us who are older. And part of it is because we're so isolated. So who would have thought that being part of a social group, or being part of a network with your church or synagogue makes a big difference as to whether or not you have a sense of well-being. The time to come has come certainly for a healthier America, that we know that everybody who's here should receive high quality of care along with health promotion and wellness, as well as disease prevention. I think, and I hope you would say, we should accept no less. Thank you.